Welcome to This Sea Ranch Life. I'm George Callis, and today we'll be speaking with Ara Chakrabarti, the CEO of Redwood Coast Medical Services. RCMS is the only health center serving the Sonoma Coast and the South Mendocino Coast. RCMS provides urgent care, primary care, dental services, and behavioral health services for a population of about 10,000 people. And now, let's speak with Ara Chakrabarti. Ara, thanks for joining us this afternoon and taking a little bit of time to talk to us about Redwood Coast Medical Services and your role there and what's happened and what may happen in the future. Ara, to get started, could you give us a little bit of background history on RCMS? Maybe a little bit of background up to the time when you joined RCMS.
Sure. Well, first of all, George, thank you very much for letting me talk to you and through you to your audience. I think it's a privilege from my end. And I think it's just important for me to communicate and be part of and include the community in the discussion. To answer your question, the history of RCMS, I believe RCMS started as a small clinic the late 70s. 77, 78 timeframe, when few locals got together and set up a clinic in Stewart's Point. Prior to that, there was nothing was here. And then through some various community members' involvement, the clinic moved to Gualala in 1985 in the building where we are now, the main building where I'm sitting right now. So that was the physical evolution. I think historically, I also understand that lack of a clinician here or medical services was some concern to the community members in late 70s, mid 70s, and that's kind of started the conversation. So after we moved here in 1985, which is the building that we are in right now, we have gone through some changes and extension. We also opened up a facility in Point Arena, a medical facility, added a dental facility in Point Arena, and right from where we are sitting in this building, we also rented the Sea-Watch, portion of the Sea-Watch building to provide medical activities. We also have another location on the Highway 1, the Elaine Jacobs Center, maybe about 3/4 mile or half a mile north of here. We mostly use that for our administrative kind of services. So that's how it's evolved. I believe that RCMS started with the rural clinic to start with, and we became a federally qualified health center, and I will go into some level of details on that, what that means. Sometimes in the 80s, late 80s, and then we have evolved from there, and we do have, and I think I'm jumping into our next question here. The kind of services we provide is kind of related. We started with just medical activities, the primary care. We added dental, we added behavioral health, and of course, one of the most important activity that we do today is also called urgent care. It's a emergency room kind of activity, and there's history to all of those. So that's kind of comprehensively what we do right now for the community.
Right. So yeah, that's quite an array of services that you provide, especially for a remote, smaller community like we are. So that's really good to know. So urgent care is when I need something immediately or there's a problem that comes up, sort of like going to an emergency room in a larger city.
Right.
Yeah. And then primary care would be like my regular doctor that I go for checkups, or somebody that I interact with for whatever medical situation I may have. I think a lot of our audience may not be aware that you provide dental services. Could you tell us a little bit more? It's in Point Arena. Tell us a little bit more of what
Yeah.
that is.
So we have on-staff dentists. We have a fully qualified dental facility. We do some minor dental surgery also. We have a dental surgeon once a month comes in. We don't do very complex dental surgery, but general dentistry that you go every 6 months visiting, and the crowns and everything else that is all covered in our dental facility. We have a fully operational dental facility, including some ability to do some minor dental surgery as well.
And if there's something more extensive needed, either as dental services or some level of medical care that is above what RCMs can do, what do you tell the patient? How do you handle the patient situation?
So we have a referral system. We refer them to a specialist, whether it is a medical specialist, like orthopedics or cardiologist, or on the dental side, a dental surgeon if it's something that's needed. And we have relationship with various hospitals, so higher level care entity, both in Santa Rosa side as well as in Fort Bragg and Ukiah side, and we referred them to them. Of course, once the referral is done, it is kind of beyond our control if the provider there takes over that. But we then follow up on once the patient comes back, because they are our patient at the end of the day.
Right. Give our audience a little bit of information. You referred to behavioral health. Explain that to our audience.
So behavioral health or mental health is maybe the maybe more common word for that. So it is we have certified clinicians who are allowed to provide mental health, and that could be from stress management to emotional distress to other kind of psychiatric and psychological help. So our providers here are qualified to do certain level, and then we have, if a medication has to be, a psychiatric medication has to be prescribed, then we have a higher level care provider that we contract with, and they're not physically here, but our clinicians contact them, and we have online or video chat with the patient, because our mental health clinicians do not prescribe psychiatric drugs, but we have that ability with outside providers to do that.
Well, that's great. So I think what you're telling us is we have an array of basic services and RCMS can handle quite a bit of what a patient might need. But in some cases, there are specialization or further services that are needed, and RCMS has a network in place to refer patients to the appropriate hospital or provider who can do that, who can step in for that patient and take their case further on.
Right. I think if George, if I may add one other thing in that context, is our urgent care. Although many places you have urgent care, many of entities like us, ours is significantly different. Our urgent care is one of the 4 urgent cares in the state that are allowed to receive emergency medical transport. That is to say, an ambulance. Only hospitals are allowed to receive ambulance because they have the capability in emergency room to treat, patients who need emergency care. We have a special provision that is given to us by California Department of Health Services because of our unique location, that we are allowed to receive ambulance. So we are the front door in many cases for emergency services, which also means that we have to have facility, training, professionals, equipments that is almost equivalent to an emergency room in a hospital. Maybe not to the extent they have in a major hospital. So we get patients, we survive them, stabilize them, and if we need be, we transport them. And that kind of goes to, we do also have an FAA-approved helipad that is known as RCMs helipad in FAA's book that we are responsible for maintaining to transport via helicopter patients, urgent care patients as they come in, if they need to be transported. So those are the uniqueness of RCMs compared to similar clinics, rural clinics.
Right. So those, to my mind, all of those services and things that you can provide kind of make us a little bit special, perhaps within California. Most remote and smaller communities don't have any of that available to them. Very, very, very little. So it's kind of amazing. Hey, let's talk a little bit about. I'm going to say around 2019, about 3 years ago, we began to hear this. This was right before your involvement with RCMS. Was that Redwood Coast Medical Services was under some amount of financial stress, perhaps up to the point where they would have to consider closing the doors, which would have been a really serious blow to the community. Talk to us about that situation and then how that got rectified.
So when I came in towards the end of 2019, you absolutely said it correctly. We were probably within a 60 days window of declaring bankruptcy. Simple, it's a simple equation. We didn't have enough funds to operate, and including paying our employees. It was without going back to the history and who was at fault and all that. I don't want to visit that, but I think it was not obvious to many people that it has been happening like that, and it doesn't happen in one day. Over a number of months, maybe if not years, it was getting to that. When I came in, I was looked at it, and I raised my hand, and I think on December of 2019, I went to Del Mar Center, and I said, "Look, this is what I'm looking at. New kid in the block, but this is not going to go anywhere. This is hitting the wall." And so we did ask for a significant. So at that time, in my calculation, we are about a $1 million deficit we are looking over the next few months. And I asked for a $500,000 donation from the community fundraising. And I said, I believe I can reduce the cost structure over the next number of months, another $500,000. So we remain solvent. The community came to help. Actually, I asked for $500,000. I think we were able to raise like $750,000 or something, which is thank you very much to the community. And we were able to do all other kinds of things, restructuring our debts, and controlling our expenses and putting in rigorous financial management techniques that helps us to get there, to get over that. Of course, we got hit with COVID as soon as we started recovering a little bit. And that was another, it dropped our revenue, patient revenue by 80% as soon as COVID was hit. But anyway, bottom line is that we've been able to manage it with appropriate structural changes we made and controls we put in. And we've been able to work on the revenue side also a little bit. So combining all that, we're in a significantly better position. We are in a fundamentally solid financial ground right now. Does not necessarily mean that we don't need some of those donations to keep coming in, because our cost structure is such that we need that as part of our operating revenue. But we are in very solid financial ground right now.
Yeah, I read the recent report from the board treasurer, and he gave a very upbeat picture of RCMS's financial footing and it's in a much better position than it's been in, I would guess, for many years. But your point is well taken. Even though you and the organization have attempted, you did the things like restructuring debt. You looked at where you could hold costs down. You made a number of adjustments to try and stay financially healthy. And then the pandemic came on top of it, which threw a huge curveball that none of us would have guessed at the time. But yet, I assume you're still, like every business in America, and RCMS is a business. There are many cost items that are outside of your control. You know, you have to purchase medicines, equipment, supplies, many other things, and the costs of those you don't necessarily control. So your costs can continue to fluctuate. Sometimes very, very sharp increases.
Right.
And so I think your point there is that it's always appropriate for the community to make a donation to RCMS.
Absolutely. And I mean, our books would not balance without some amount of donations and contribution from the community. And given even just the current situation of the inflationary pressure that we are seeing in everything, 8, 9, 10% of inflation, that gets computed back into us in our expenses. So yes, I think it is always needed and helpful, and I think we are very thankful for the community to help us with that. I think it's a realization the importance of RCMs, the role we play in the community, which is absolutely critical for the community to be the community here. And we much appreciate the donations and the funds that gets coming our way through donation.
Ara, let's turn the conversation a little bit to what I guess is another challenge that you're facing. Once again, a challenge that many businesses in America, most businesses in America are facing, and that is staffing. Finding competent people, qualified people who want to live in this area and work work in the healthcare field. Tell us what some of those challenges have been for RCMS.
So, I will kind of take a step back and I'll say that during the last couple of years, the pandemic time, healthcare providers, the healthcare industry is one of the most impacted industry. Almost 25% of healthcare workers, clinicians, support staff, MAs, the whole line of people who work in healthcare industry have either quit or decided to retire because the pressure of the pandemic, or various other related effect of that is decimated the healthcare industry in this country. 20+% of rural healthcare providing entity in this country has closed over the last 24 months.
Well, would you repeat that number for our audience? Because that's a big number.
20+% of rural healthcare providing entities that have either closed or significantly shrunk in their ability to provide healthcare service, simply because they don't have the resources. People resource, financial resource, operating resource. This COVID pandemic has devastated that industry. So that is the context under which we have to work. And we realize, our team here realized that RCMS is the only game in town here for healthcare providing. We are not next to a highway that you can jump on the car and drive for half an hour into a facility that can provide you care. You have to drive for an hour and a half, and in winter, when the roads are flooded, you may not be able to go anywhere. So that's the fundamental perspective that we try to internalize, and so we work very hard to fill those positions that is absolutely needed to provide the service. That has become one of the biggest challenges right now. There's not enough providers, not enough certified clinical staff locally available, and recruiting anybody from outside, it's not easy. Not only for the reason there's a shortage of those kind of people, but also we are remote, we are rural, we are away from the city. Our school systems and everything has barriers. We don't have other industry here. For example, if we hire a provider whose wife or husband is working in another industry, there is no industry here. So I think those are making the challenges significantly more complex and challenging for us. But that does not stop us from continuing to be creative in trying to get providers here. We are trying to work with, part-time providers who can only stay here for 3 days a week and go back to Santa Rosa or some other place. We are trying to be creative on the compensation package. We're trying to be creative on the housing side. These are all the challenges, but George, your point is very, very well taken. If there is one single problem that is keeping me awake at night, it's a human resource problem for running this organization.
Yeah. And you alluded to this, that's complicated by the fact that housing is scarce in this area and it tends to be very expensive. And so that must make it difficult to attract staff.
Absolutely. And I would say that the community has come to bat for us. Whenever we have asked for help in finding a place for a provider or a rental, or and I think the Sea Ranch community in particular, but in general, the overall community has been very helpful trying to accommodate and provide housing, etc., that is more reasonable and available to our providers and other staff members.
So, excuse me, anyone who's viewing this, if they say I have a room or a house, or there's a number of houses that have guest homes associated with them, all kinds of things, should they call you? Should they call RCMs and say, I may have some?
I think so. We are always looking for, the only thing I would say that, if somebody gives us a housing and say that they will be charging us what they charge short-time renters, that makes it a little difficult for us to.
Right. Yeah. So an offer to provide some rental housing for someone, it needs to be viewed as somewhat of a donation. You may not get the market rate.
Exactly. Yeah.
But it's a contribution to RCMs.
Absolutely.
Let's talk a little bit about the physical facilities at RCMS. As you mentioned, you have the main building there in Wallala. You've got some other locations in Wallala. You've got a location in Point Arena. I'm thinking a little bit long term now. Are these adequate? Will RCMS need to think about upgrading, modernizing, renovating, new facilities? I realize that's probably down the line, but is that something that you are beginning to think about?
Absolutely. The answer is to all those is yes, yes, yes. The facility that we have, the main facility we have, it was built in 1985. It was never built for a medical facility. My understanding is that it was built as an office building, and RCMs moved in, and of course, we are providing medical care. It is not up to the standards today or the tomorrow standards of medical service delivery facility. I mean, that's fundamental. The way medical services are getting delivered in our country today and tomorrow and 5 years down the line is going to be somewhat different from the way it was done in the past. It is more technology based, it's more equipment based, it's based on ability to separate patients differently, and tools, technology, process, procedures are changing, including the providers who are coming in now that has recently graduated from medical school. They learned the service delivery of medical services differently than somebody who graduated from a medical school 30 years back. That is a fundamental point, that our facility today will not be able to keep up with the service delivery requirements of tomorrow. And that tomorrow is not tomorrow next month, it's 5 years, 10 years down the line. That needs to be comprehended. So we need to have a strategic plan that looks at the facility, that continue to able to provide the services, medical services of tomorrow. One fundamental thing that we need to keep in mind, George, is that there is not going to be another option for RCMs or for the people here to go to. RCMs is only game in town for healthcare service. No hospital is going to come and set up a shop here. The economics don't work. I mean, I've looked at it, I've talked to everybody they would listen to, all the way from, San Francisco General to Sutter to Adventist Hospital. And no one is interested simply because it's a sad story in our country. The economics don't work to set up a shop here. So we have to be the only one. And that means it requires us to think about the facility. What we're doing now is that we made some changes and modification in the ground floor or the first floor of the main building. We made it a little bit more workable and functional. Now we have to focus on the upstairs, the clinical side of the house. And we're putting together a strategy, a longer term game plan to address that. So it is, I would say that, yes, that is one of the main item that we are thinking through for a longer term game plan, strategic plan for our RCMs.
And that's going to, that kind of planning, the strategic planning, 5 years and on out, and as healthcare changes, as you were describing, that's going to require a community to step up in a financial way again, isn't it?
Absolutely. And I think we want to do it in collaboration with the community. In fact, we're just kicking off some of those initiatives to get a small group of people involved and discuss with them, get their viewpoint, and kind of start putting the plan together, because you're absolutely right. It will require community's participation, help, donation to make that happen.
Yeah. Thinking about that, I've got noted on my calendar and has been advertised around that RCMS will hold what I would call a town hall style meeting, where it's interactive between you and perhaps other folks from RMCS and the community at large, for people to talk, express ideas, and for you, it sounds like it's information gathering for you. Is that correct? Oh, by the way, that meeting is on August 21st.
Correct.
At the Del Mar Center on the Sea Ranch, but yes. It's but anyone in the community, Sea Ranch or not, are welcome to attend that. Is that correct?
That is correct. I would hope that anybody who's interested, who cares about RCMs, will be able to come and listen to it. And the idea of this is to give a little bit of a status of where we are. Remember, I took the job at Del Mar Center when I presented this, and people came up to say, "Why didn't you take this job?" And I haven't been able to go back and report back. But not only I want to give a status of the situation, kind of the state of the state, if I could call it, but I want to listen from the community, and our staff wants to listen and learn and see what the issues are, what you guys want us to focus on as we go forward. So it's a conversation, it's a dialogue, it's learning, listening, and I think it's important to have that kind of communication, because we are a community-supported healthcare center.
Yeah, absolutely. And just for our listeners, I could remind them, you can echo if this is correct, Ara, but board meetings, RCMS board meetings, are open for anyone to attend, any member of the public who wishes to attend and hear straight from the board and yourself and other people exactly what's going on at RCMS. It's very open, it's very transparent, and I would just add, as you said, anyone to whom RCMS is important. I would emphasize that at some point or another, all of us are going to need RCMS, one way or the other. I'm in good health right now, but I don't know about next year.
If I may say this, and some people will be listening to this, they must have heard me saying this many times. And I'm just paraphrasing a quote that somebody made to me, one of the community members, that If we didn't have a grocery store here, it'll be somewhat difficult to live. If we didn't have a good restaurant here, it'll be somewhat difficult to live. But if we didn't have an RCMS, it may not be possible to live here.
Yeah, yeah, very, 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 very true. Absolutely.
I know there's time is running out.
Yeah, we have a little bit of time. Yeah, why don't you express some other things that you wanted to bring up?
Yeah, one of the things that I want to talk about is the COVID situation. I think I just want to remind everybody that the pandemic is still with us. Of course, the impact is somewhat lessened, and many of our population has been vaccinated. We are looking at 80+% vaccination rate here in our community. Which also didn't happen by magic. I think RCMS played a key role in making that happen, but that's another discussion. So I think I just want to encourage people to still take the precautions. If you're not vaccinated or boosted, please do that and follow the public health guidelines. And the other thing I also want to mention is that about the monkeypox. Although there is no monkeypox here, in Mendocino County, I believe as of late last week, there was 0. Sonoma County has about 20 or so positive cases. But we are one of the first clinic that we are getting the monkeypox vaccine. So we should be getting monkeypox vaccine, a small number of them early next week. So we are prepared. If we do see something happening in the community, we'll be able to treat. So I think that's an important news. We are probably the first clinic we are getting monkeypox vaccine outside of the larger, San Francisco, LA area where this is. So I think that also goes to show that we are fighting for the community, that someone just didn't come to give it to us. We had to fight for it to get it to us. And that's how we approach healthcare services, our responsibility to the community. And we did that during the COVID also. I know we were forgotten by the public health. We are so far away from Ukiah or Santa Rosa, they didn't know that we exist, that we have about 10,000 people here. We had to fight tooth and nail to get the supplies to do the testing. And to get the vaccination. We are the first one to find a positive case in Mendocino County in our clinic.
Wow.
So I'm just trying to say that, we are trying to do our as much as we can from our side. We take this seriously, that we feel a absolute important need in the community.
Yeah, absolutely. And I think many of us would agree that RCMS really stepped up with the vaccination and testing and vaccination. And I personally got all of my vaccinations at RCMS, the first 2 doses, the boosters, and then I've caught up on a few other vaccine and not COVID, other things that I had let lapse, and RCMS was there so that I could do that. So you're right, a very necessary service, and certainly 80% vaccination is very good, especially compared to many other areas. Ara, is there anything else you'd like to add and mention to the audience?
Well, I think, I believe RCMS is part of the community. It is our community, and it is our RCMS. And I think that's how I would like all of us to think, that we have, all of us, whether we use RCMS or not, we are vested in this. We have vested interest. So RCMS will not be successful without involvement of the community, without help from the community, without the guidance of the community. So I would say, please stay engaged, get engaged, help us to help you, to help us all. So that's the way I would look at it. And that's the goal, that's the game plan for RCMS.
Wow, thanks, Ara. That's been great. And I do appreciate you taking this time with us and bringing us up to speed on RCMS, Redwood Coast Medical Services, and Ara Chakrabarti. Thank you for giving us your thoughts and times. Really appreciate it.
Thank you. Thank you for the opportunity.
You've been watching This Sea Ranch Life. Today's guest has been Ara Chakrabarti, CEO of Redwood Coast Medical Services. To learn more about RCMS, visit rcms-healthcare.org. Thanks for watching. I will see you again on This Sea Ranch Life.